Okay, thanks, Sharon. Hi, everybody. Just wanted to ground us where we are in Washington State. We are in a very good relationship with the UW Virology Lab and the labs around the state that are obtaining specimens for genotyping for these variants of concern. And as of last week, we had 20 of these variants of concern, the B117. What has changed is we have doubled that amount. We now have 19 additional B117s that came out this week. And B117, by the way, if you're not a numbers memorizer kind of person, the UK variant that we have learned about. And we have not seen other variants until this week, where we found the first B1351, or the South African variant, and we'll talk a little more about that. That was found in Washington State. And the point of concern here is, if you look at our number of cases, it certainly looks like we're on a decrease in case counts for COVID in general across the state of Washington. But I really want to caution us with the emergence of these variants, especially a doubling in the number of our variants detected this week. I'm very concerned how this is going to affect our trajectory. So this is now the time to really double down on all the efforts on this call today to help prevent the spread of these variants in Washington State. And with that, I'll turn it back to you, Sharon.
Thank you very much, Dr. Lindquist. And now we'll hear from Dr. Jeff Duchin. Dr. Duchen is Health Officer for Public Health Seattle and King County.
Thanks, Sharon. Thanks, Dr. Lindquist, and thanks to everyone who's joining us. Increasing reports of variant COVID or coronaviruses are not unexpected. So increasing reports of variants are not unexpected. This virus will continue to evolve and new variants will continue to appear, but not all variants have implications for human health. But some variants, called variants of concern, are significant because they're better at spreading or infecting us, or they may cause more severe illness, or they may be able to evade some degree of immunity from infection with earlier variants or from vaccine. Both the B117 and the B1351 are variants of concern. The B117 is known to spread more effectively and more quickly from person to person and may cause more severe illness. It's not clear if the B1351 variant spreads more rapidly or causes more severe illness than other strains. But it does appear the level of immunity or protection from infection with earlier strains and to some degree from vaccines is lower for this virus. So we must be mindful that there's a lot we don't understand about COVID-19 and the SARS-CoV-2 that spreads, that causes COVID-19 and how it spreads. And although we expect the proportion and number of these variants to grow over the coming weeks, it's not possible to predict exactly how fast this will happen or how one or the other will ultimately change the trajectory of our outbreak. I think the bottom line is that although our current dropping case counts and outbreak trajectory are great and a cause for guarded optimism, we must keep in mind that we remain vulnerable to a potentially severe fourth wave, given the large number of susceptible people that remain in our population, the presence of these variants of concern that are expected to increase, and the easing of restrictions on activity, presenting more opportunities for the spread of COVID-19. Now, limiting the spread of all COVID-19 viruses will decrease the risk from variant strains. We can decrease the risk for a large fourth wave by continuing to practice COVID-19 prevention measures and continuing to vaccinate as quickly as vaccine supplies allow. We're in a much better place today than we were a month ago, but we must recognize the threat of complacency and not ease up on COVID-19 precautions at this time. And this means, for the time being, continuing to limit activities, wearing well-made and well-fitting face masks, avoiding or spending as little time as possible indoors with others from outside the home and in indoor crowded spaces, improving indoor ventilation, spending more time outdoors, and using good hand washing. And it's also important to remember to isolate and get tested if you have symptoms of COVID-19, quarantine and get tested if you've been exposed to someone with COVID-19, and let your close contacts know if you've been diagnosed or think you have COVID-19. If we manage to stay strong with COVID-19 prevention measures for a few more months and continue to decrease transmission and get people vaccinated as vaccine supplies become available, we can avoid a severe fourth wave and have a much healthier and more normal summertime. With that, I'll turn it back to Sharon.
Thanks so much, Dr. Duchin. And we will take some questions from our media partners. If you'd like to ask a question, please use the raise your hand function in Zoom and we'll call on you. We also have Dr. Roychoudhury and Dr. Greninger from the UW Medicine Virology Laboratory who are also available to take your questions. They were involved in the sequencing of the variants. So with that, we'll take our first question and please state your media outlet. So we'll start with Nick Popham. Nick, you're unmuted.
Thanks so much, Nick Popham with Como TV. Thanks again for always talking with us. I was wondering how effective these vaccines are against the South African variant now that we've found it in Washington State.
Yeah, Dr. Duchin, do you want to start off there? Sure.
Nick, good morning. Thanks for your question. I would say, you know, to summarize, the South African variant, the 1351, appears to be able to cause illness in people to a greater extent who have been vaccinated compared with the previous strains. The vaccine, and there are a number of vaccines that have been tested and used in South Africa. And there's an AstraZeneca vaccine, there's a Johnson & Johnson. People have done some laboratory studies looking at antibodies and levels for the mRNA vaccines. I think the safest thing to say in summary is that there's some reduced protection. I don't think it's well characterized yet, the extent of that reduction or the implications on human health. It appears that the vaccines remain protective against severe disease and hospitalization, which is the most important factor. But the degree to which protection against any infection or more severe infections might be reduced, I think is not fully understood. But clearly, there appears to be some reduction in the level of antibodies that are thought to be significant for protection. And vaccine manufacturers are considering the potential need to reformulate vaccines if this is borne out. And it's good news that yesterday the FDA created guidelines for industry on how they can do that rapidly if it becomes necessary.
Appreciate that, Dr. Duchin. Just one follow-up, maybe to turn it to Dr. Lindquist. From both of your perspective, should this influence any behavior change or differences in folks signing up to get the vaccine at this point?
A couple things here. The good news is it's still, this virus and these variants still respond to all the things that Dr. Duchin outlined for all of us earlier. Wearing a good made and tight fitting mask, 6 foot distancing, avoiding social gatherings outside your family home, all these things still work against this virus. The other bright piece in the vaccine is that the Johnson & Johnson vaccine that is in front of the FDA for EUA approval this week actually was tested in some of these strains from South Africa. So we do know it's, like Dr. Duchin pointed out, it is not quite as effective, but it still prevents severe disease, hospitalization, and death. So that's very promising to us on the verge of having Johnson & Johnson added to our vaccines here. Again, we have 2 vaccines, the Moderna vaccine and the Pfizer vaccine. And if Johnson & Johnson gets approved, that would be our 3rd vaccine.
And I would just follow up by saying this news should absolutely not change anyone's behavior about vaccine. Our vaccines are incredibly effective against the strains that are common here locally and in the US. Our vaccines that are currently licensed or I should say currently authorized, are incredibly effective against the B117, highly protective. And there's no reason at this point to assume that the South African 1351 variant is going to become predominant. We just don't know, but it's been found in a number of states across the country, small numbers, but it's likely present, in higher numbers than have been detected. But we still don't know whether or not this virus is going to become, the predominant virus, how widely it may spread, and what the impacts are should that happen. So this news should not have any impact at all or influence anyone's behavior at all about whether or not they seek vaccine. We strongly encourage everyone to seek vaccine. With our vaccines are highly effective against the strains that are common here in the US. What it should do is cause people to double down their efforts to prevent COVID transmission, period. All viruses, all circumstances, any opportunity. Remember that you can't tell who has COVID-19 from looking at them. A large proportion, up to half, may spread from people before they look or feel ill, before they develop symptoms. So please take precautions. We'll all do best when we get the levels of COVID-19 transmission in general, all strains, down as low as possible.
Thank you. We have a question from Graham Johnson. Graham, go ahead.
Hi, it's Graham Johnson from Cairo TV. Many thanks for this. 2 questions. With the arrival and the growth of these variants, at what point would you advocate a return of tighter restrictions against activities like indoor dining? I'm also wondering if you might address whether you feel people are taking enough advantage of the testing opportunities that are now available. Thanks so much.
Thank you for that, Graham. Dr. Lindquist, can you start us off?
Yeah, Graham, that's a great question. And it is one of the big conversations we're having with the governor and the governor's office right now. The concern, given that on one hand, our epidemiology is showing us a pretty steep decline in the number of cases, but on this hand, us reporting a doubling in our cases of variants really leads us to this big concern of we have opened to phase 2 across the state of Washington. Should we take stock of where we are, look for these variants before we make other decisions? This is an ongoing discussion right now with the governor and the governor's office. So more to come on that. And the second part of your question was, say it again.
I'm just wondering if you might be able to address whether you feel people are taking enough advantage of the testing opportunities that are now available.
Yes and no would be my answer to that. Certainly the number of people getting tested right now is declining. And so in that sense, our best way to really isolate and quarantine is to be testing and identifying those who are contacts around cases to get them in quarantine. So like we said earlier, it's really the time to double down on all these efforts, wearing a mask, social distancing, getting tested if you have been exposed, getting tested if you have symptoms, isolating if you are positive, and clearly identifying those contacts that have been around you. This is especially important if you have one of these variants of concern, that we are clearly investigating every case and that we are clearly identifying contacts to those cases so they can be quarantined and tested.
Thank you. Let's take a question from John Ryan. You're unmuted. We'll give John another moment. Let's come.
Sorry, here I am. Can you hear me now?
Oh, there you go. Go ahead.
My apologies. Yeah, I'm wondering how many cases a day the state is currently doing to identify the different variants, and are we doing anywhere near enough to really understand the scale of the variant presence here?
Yeah, I can take this one, Sharon.
Great.
Yeah, so that is really the concern. Is in the United States, we are genotyping less than 1% of all our isolates, compared to other countries like the United Kingdom that does a much higher percentage. We have a lot to learn and to really increase our genotyping. So this has been a major focus of mine, and certainly of the states, is to increase the percentage of all positive results to, our goal is 5% of all the positive COVID tests get genotyping. So that's happening through a couple mechanisms. One is having contracted labs and partnerships with the lab folks that are on the call here, University of Washington, some private labs in Seattle, and also the state public health lab taking on genotyping. Currently, we're at about 2% of all samples, which puts us in the top 5 states across the United States for percent genotyped. And we want to exceed that because no, I do not think we are doing enough surveillance that is representative. And the other concern here, is it representative of every community in Washington state? Is it representative of the east side of the state? Is it representative of the high risk groups? Do we have some equity in where we're actually getting samples and genotyping? So that is a huge focus right now for the Department of Health.
I don't know if Dr. Greninger or any UW colleagues want to add anything. Feel free.
I would just say, I really agree with everything that's being said here. So there's not too much to add. We really appreciate our partnership with King County and the state here, especially for sequencing. We've always been increasing our sequencing capacity in the last few weeks, and trying to get out 500 or so a week here, so we can easily catch those 5% targets. And also love to have Pavitra, Dr. Roychoudhury, say a few words if you want about the sequencing.
Yeah, thanks, Alex. Yeah, we've been trying to increase our sequencing. We actually do a lot of sequencing for various studies on any given week, but we want to do more for the purposes of surveillance alone. And so with that, we want to shift our focus to doing a lot more of that, and that's in progress. And we want to hit that target of 500 to 600 samples a week to help the state hit 5% of all positives.
Wonderful, thank you. And feel free to jump on in as well. As Dr. Duchen said, we appreciate your partnership and your work that you're doing. Let's take a question from Ariel Dreyer. You are unmuted.
Great, thank you. This is Ariel with the Spokesman Review in Spokane. I have a couple questions. Do we have an estimate of how many additional variant cases are out there for each one confirmed? And then do we have any confirmation of the variants in Eastern Washington yet? And how likely is it that they're already here if we don't?
Dr. Lindquist, can you?
Yeah, so I can answer that. There's 3 parts that I heard in that. No, we have not had a variant from the eastern side of the state. We have done a lot of genotyping in Yakima in particular, but we have not found any of these variants yet on the east side. Part of that is really increasing the number of positive samples coming in from the east side to make sure that we can detect it. Yes, I think it is here. Yes, I do believe it is in Eastern Washington already. We just are not sampling enough to detect it yet. And to be honest, I wouldn't even hazard a guess of how many samples are out there that are positive that have not been tested compared to everyone that's tested. I think I'll have a better picture of that in 2 weeks as we're really getting more representative sample, and then we can calculate what we think that the true average across the state is.
I would just also add that our colleague Trevor Bedford over at the Fred Hutch sometimes can make modeling predictions about the prevalence of variant strains based on information that he has related to lineages and numbers that coming in and sampling. So you might consider seeing if he's got anything he wants to add to that to help answer that question.
Thanks. Let's take a question from Glenn Farley. You're unmuted. We'll give Glenn another moment.
Hang on. There we go.
There you go.
Double unmute. As we look at how these variants have affected other countries, like the UK variant, the 117, It seems from everything that I read, they are still seeing a decline in cases, although it does seem that they are doing better at getting more vaccines into arms as a percentage of their population. As you look at that, unless that's incorrect, that seems to give us some hope, despite the concern that that would become the most dominant strain.
Dr. Duchin, do you want to start us off?
Yeah, thanks for the question. So, you know, the B117 variant caused a very large outbreak in the UK and Ireland and other countries in Europe. Now, it was introduced at a time when their trajectory was going upwards, but nonetheless, you know, it did cause a very large outbreak before it started to decline, and it declined in response to very rigorous lockdown measures as well, you know, weeks and weeks of lockdown. So we don't want to go there. We think that this virus has the potential to do that. We don't want to give it the opportunity and create the circumstances that would allow that to happen. And by minimizing any opportunity for COVID transmission at all, regardless of whether it's a variant or not, we can interrupt the spread of variants and keep the numbers low. You know, as we get more people vaccinated, that will also add protection against B117. So there are a number of things in our favor here, that these variants are increasing at a time when our outbreak is decreasing, that we're on a downward trajectory, not an upward trajectory at the time that they're growing, and that we have some experience in effectively suppressing COVID transmission. But we don't want to, you know, give the virus a break here to become complacent, to ease up on our precautions and allow it to get some momentum, because we know that it spreads more quickly, and that will result in more hospitalizations and more deaths more quickly. And we don't want to start going in that direction. So as Dr. Lindquist mentioned earlier, you know, we're going to need to monitor our case rates very closely to see if we're seeing any indication that our trend is turning around and rising upward again. And that will be, you know, an important indicator of whether or not we need to consider any change in the current permitted activities and need new restrictions.
And Dr. Lindquist, anything to add?
No, Dr. Duchen has said it well.
Okay, great. Let's take a question from Ryan Harris. You are unmuted.
All right, thanks for that. A couple of quick questions. Firstly, what are your concerns about the person with the South Africa variant being unreachable by contact tracing, and will that effort continue? And also, if you can address concerns that the South Africa variant can affect people previously infected with another strain.
Mm-hmm. Thank you. So, you know, we really would desire to be able to contact every COVID-19 case that is reported to us, but there's a proportion that are lost to follow-up for whatever reason. Now, this case occurred 3 weeks ago, and we're hoping that this virus, well, the person got the appropriate counseling at the time of his positive test result when it was first reported as a COVID case, and took the appropriate precautions, informed their contacts, and people were quarantined and tested. We really don't know, you know, whether this case led to further transmission or not. There's just no way to know at this point. It's important to remember, though, that with all these variants, when we talk about variants, we're looking at a very small sample, tip of the iceberg phenomenon. So we all acknowledge that there are other cases out there of variants that haven't been tested or sequenced, or maybe haven't even been tested to determine whether they have a COVID-19 case at all. And so we really emphasize the importance of everyone taking the appropriate precautions when they develop symptoms, isolating themselves, getting tested quickly, notifying their contacts, having contacts quarantined and be tested. And we rely on that whether or not we know that someone has a variant strain or not. And you know, of course, we're always concerned because we know the way when COVID is spreading, there's no public health follow-up. You know, there's likely a higher risk for secondary cases. But for just this one case that occurred 3 weeks ago, you know, we are still trying to contact this person. But I don't really know that there would be much that we would do, could do that would make a difference, a month later. It's really a general public health message to everyone to take the proper precautions and do what's right at the time of their diagnosis. What was the second part of your question again?
Sorry, I had to unmute there again. I'm hoping you can address the concerns about the South Africa variant being able to infect people who've already had another strain of COVID.
Yeah, it's really related to that issue around, vaccine effectiveness as well. Basically, this virus has changed a bit. In particular, this, the way the structure of its spike protein has changed a bit. That allows it to look a little bit different to the immune system, so that there have been some cases reported from South Africa of infections with this B1351 variant in people who are previously infected. It's not clear that they have serious infections or require, hospitalization, but it may cause reinfection. And it's not terribly surprising, because we do know that coronaviruses can reinfect people. There have been cases of reinfection with, the so-called non-variant strains as well. But it's very concerning, because what it makes us worried about is that, this virus is sufficiently different that will require potentially adjustment in vaccines, and that people may be somewhat more susceptible to reinfection. It's all hypothetical at this point, but it is a real concern, and it needs to be monitored closely.
Thanks. Anything else to add from our other panelists on that?
The only thing I'd add is to make a plea to the public. When you have a positive test and you are contacted by the public health system, please be part of the solution. Answer your phone, answer the questions, be truthful, so that we can identify any of your contacts and they can be quarantined and tested if needed. That we really need the public's help, especially during this time that we're seeing an increase in these variants of concern.
I would also add that, there's been questions about whether diagnostics can detect these variants, and there really is no problem with any of the platforms in being able to detect these variants. That's how we're detecting them. That's how we're sequencing. We know the sequence of the virus. We know where the diagnostic tests are binding the virus. They're not affecting that. So we're totally covered. And also almost every test has 2 or 3 targets for the virus. So even if one of them goes down, there's another one there to pick it up. So we're fine on the diagnostic space here.
That's helpful. Thank you. I think we have time for just 1 or 2 more questions. Alex Crochet, you're unmuted.
Hi. So do you have any kind of an estimate of how long this variant would have been here in the state of Washington? And then if you are able to estimate that, timetable, do you have any idea, like a real number of how many cases we could be looking at here in the state as of right now?
So I can just reiterate one thing here. So we have been doing a lot of genotyping since the beginning of this outbreak, and we have over 6,000 samples genotyped. We have not detected any of these variants of concern until about a month ago. But the real answer to your question is what Dr. Duchen pointed out earlier, is we have colleagues in molecular genetics and diagnostics that can look at the current strains and make estimates of how long it's been here, what's the estimate of the true prevalence in the state. And I would redirect you, if you didn't hear that name, that it's Trevor Bedford, and see if he has any estimates on this. Some of this genetic information we get from genotyping isn't just as simple as is it here or not. It also shows us how related are these first 20 B117 variants. And the surprise to me was that they were not all exactly the same, and they were not all related to each other. So that tells me we've had multiple introductions into Washington state, and that we may have multiple variants of the B117. So again, redirecting to our colleagues in academics, and Trevor Bedford being one of the national leaders on this would be a good answer for that question.
Thank you.
It is very hard to figure out exactly, for if you have one isolate that's been genotyped, it's almost impossible to figure out, how long it's been spreading here. So it does definitely help when you have more isolates that are genotyped.
Yeah, Dr. Roychoudhury, anything to add on that?
Yeah, just the same, just to echo that the more we sequence these positives and pick up multiple variants, we can see how related they are to each other, and that will help us determine how many times it has been introduced into the state, and also potentially estimate how long it's been circulating in the state.
Great. I think we have time for one more question. Pablo Gaviria from Univision. I saw the hand raised, but then maybe it went down. So did you have a question? We'll give Pablo just a moment.
Yeah, I think it was partially answered, but do you do anything different as far as contact tracing when you detect one of these variants of concern?
I'll start with that, and then Dr. Lindquist can follow up. We treat these viruses similarly. COVID, SARS-CoV-2, COVID-19, they spread fundamentally in the same ways. They spread primarily through the air, and especially well in indoor air spaces where people spend lots of time, and particularly if they don't wear masks. And they spread particularly well to close contacts as opposed to people who are at a distance, but they can build up in the airspace over time and spread over farther distances. But those fundamental, transmission routes are similar for the viruses. So we do the same type of contact investigation and give the same type of prevention advice, regardless of what the strain is. And we acknowledge, we have to acknowledge at this point, we usually don't know what type of, what the variant is or the sequencing data are on the vast majority of COVID cases that we deal with every day. Only a small proportion of them are getting sequenced and identified as a variant. So we need to, really almost assume that we're treating everything as a potential variant. And what that means is taking all possible precautions to protect yourself, protect your household members, protect your community by doing all the things that we know are effective in suppressing transmission. Masks, good, well-made, well-fit face masks, keeping distance, limiting activities, making sure people who have symptoms of COVID get tested, people who've been exposed, quarantine and get tested, isolate if there have been symptoms, and so on. It's really the exact same public health, disease control and outbreak response measures, regardless of whether we know we have a variant of concern or not.
Thank you for that.
Thank you. And as we close, I'd like to turn it over to our UW Medicine Virology Lab partners. Any final words from you, and then we'll turn it back over to our health officials.
I think we've covered most of the things to cover today. I just really appreciate our relationship with the state and King County, and want to just keep that going. Just appreciate all the labs across the state that are working hard diagnosing cases. We've done a great job in Washington State, and we kind of continue the momentum all the way till everyone's vaccinated.
Likewise, we really appreciate the partnership. Also wanted to mention that we also share our sequences so that all of these calculations and projections can be made. So that's a big part of what we do as well. And we will be doing that for all of the surveillance sequencing that we're doing here.
Thank you. I know there's a lot of appreciation for all the partnership work going on across the health system. Dr. Lindquist, any final thoughts from you?
Yeah, I just want to use this time to highlight how critical the public health lab system, which I include the University of Washington as part of the public health lab system, is. Whenever there is an epidemic or an outbreak or a pandemic, the results are always dependent on our lab capacity, on our lab's ability to have the newest and best diagnostic tests, ability to have timely diagnostic tests. And this really is not just dependent on public health labs. Both King County and the state have a public health lab. It's really dependent on where those public health labs need expertise, like the University of Washington, Dr. Greninger's lab for sure, or Dr. Bedford's lab. These are lessons we learn over and over, and I just want us to highlight the importance, the need for funding, the need for partnerships, and the ability to continue this for preparedness into the future. This is not our last pandemic. And so having strong lab and public health systems will really be the lessons we learn from this.
Thank you so much, Dr. Lindquist. And any final thoughts for you, Jeff?
I would just remind folks that a COVID-19 outbreak is not over. We'd like it to be. We're really sick of it. We're literally, physically, and mentally sick of it. But it continues to throw challenges at us, and we need to respond because we do have the tools to make this manageable, to decrease the level of cases, hospitalizations, and deaths by taking our prevention steps, and ultimately through vaccination, we will be able to return to very close to our pre-COVID existence, hopefully sometime this summer or fall. But it's going to require continued work and effort. And I just want to thank everyone in advance for doing what we're going to need to do as a community to get through this as safely as possible. So thank you.